Bismillahirrahmanirrahim. Model of the ear, external ear, the middle ear, and the internal ear. Okay, so start with the external ear, and this is the auricle. This whole structure is the auricle, and this part represents the helix of the auricle. This is the scaphoid fossa, the triangular fossa, and this is the antihelix. And these are the crura of the antihelix. This is the antihelix. The intertragic notch. This is the lobule of the ear. The tragus should be over here. This is the antitragus. The tragus should be over here, and here we'll have the auricular tubercle. This is the concha of the auricle. Antihelix, the tragus, intertragic notch, auricular tubercle, concha of the auricle, external acoustic meatus. Now I'll move on inside, and this is the superior auricularis muscle. This is the superior auricularis muscle. This is fat, and this is the temporalis muscle. And these are the cartilages of the auricle. And this is the cartilaginous part of the external acoustic meatus. And now this is the bony part of the external acoustic meatus. This is the internal jugular vein, and this region represents most probably the parotid gland. Internal jugular vein, the internal carotid artery. So external acoustic meatus, it continues. So this is the tympanic membrane, the position of the tympanic membrane. And here we have the eustachian tube, the auditory tube. This is the levator, the tensor tympanic in this region. This is the inner ear along with the cochlea, vestibular nerve, and along with these are the semicircular canals. The facial nerve should be in this region. And here you will find the tympanic recess. Model demonstration of the inner ear, the vestibular apparatus, and the cochlear apparatus, concerned with the sense of hearing, balance, and posture, and equilibrium. So we start with the semicircular canals first. This one is the lateral semicircular canal. This is the posterior semicircular canal. The posterior one. And this is the anterior semicircular canal. These dilatations present at the base of the semicircular canals are known as the ampulla or crista ampullaris. There is another dilatation, ampulla, and this outer covering is actually the bony labyrinth of the inner ear, and this is the membranous labyrinth. Now the space between the bony labyrinth and the membranous labyrinth is filled with the endolymph. Perilymph. The space between the membranous labyrinth and the bony labyrinth is filled with the perilymph, and the membranous labyrinth inside is filled with endolymph. So yeah, endolymph. Okay, so this is the utricle, the saccule, and this is the endolymphatic duct, which leads into the endolymphatic sac. Endolymphatic duct which leads into the endolymphic sac. Okay, so this whole structure represents the vestibule. These are the semicircular canals, and the anterior and the posterior semicircular canals actually meet at a point known as the common bony limb. The meeting point of the anterior and posterior semicircular canals, common bony limb. So we'll also have a common membranous limb. This will be the common membranous limb. Okay, and this is the cochlea. So the cochlea, this is the cochlea. The vestibulocochlear nerve arises from here. And now you look at the cochlea from the inside. So inside you've got a cross section of the cochlea. This is the osseous spiral lamina. These structures are the osseous spiral lamina. These whitish structures, osseous spiral lamina. And this is these are the different nerve fibers which join to form the cochlear nerve. This is the cochlear nerve, and these are the spiral ganglion of corti. Spiral ganglion of corti, having the spiral mordular arteries. These are the spiral mordular arteries. We've got the scala vestibuli, scala tympani, and this is the cochlear duct or the scala media. This is the vestibular membrane or Reisner's membrane. This is the vestibular membrane or Reisner's membrane. The Tectorial membrane, the organ of corti, the osseous cochlea, the basilar membrane,